The Lord is my strength and my shield. In him my heart trusts, and I am helped. My heart exults, and with my song I give thanks to him. Good morning and a warm welcome to St. Martha's Hospital, Bangalore, a beacon of compassionate care and medical excellence. Established with a commitment to providing high-quality healthcare, our hospital blends a cutting-edge technology with a warm, patient-centered approach. Here, our dedicated team of professionals work tirelessly to offer personalized care, ensuring that every patient receives the best treatment in a comforting environment. St. Martha's Hospital has been serving generations compassionately since 1886, that is 138 years completed of its excellence. We have gathered here to witness the inauguration of our latest state-of-the-art technology, CT MRI Scan Center. As we remember the countless blessings that our Almighty God has showered on this hospital and on all of us, let us begin with a hymn, Bless the Lord, O my soul.
Bless the Lord, O my soul, O my soul, worship his holy name, sing like never before, O my soul, I'll worship your holy. New day dawning, it's time to sing your song again. Whatever may pass and whatever lies before me, let me be singing when the evening comes. Bless the Lord, oh my soul, oh my soul. Worship His holy name. Sing like never before, oh my soul. I'll worship Your holy name. You're rich in love and You're slow to anger. Your name is great and Your heart is kind. For all Your goodness, I will keep on singing. 10,000 reasons for my heart to find. Bless the Lord, oh my soul, oh my soul. Worship His holy name. Sing like never before, oh my soul. I'll worship Your holy name.
It is with great pleasure that I invite our Sister Superior, Sister Gracie Thomas, who has agreed to welcome our esteemed Chief Guest, Honorable Minister for Health and Family Welfare, Mr. Dinesh Gundu, and the distinguished gathering. Please join me in giving a heartfelt round of applause to Sister Gracie, who with her warm spirit and eloquent words will set the tone for the inauguration with her welcome address.
Sri Dinesh Gundu, the Honorable Minister of Health and Family Welfare, Government of Karnataka, Mr. Appachan Kuttiyat Joseph, the Director, Dr. Christy Dominic Savio, the Medical Superintendent, Dr. Arun Kumar, the Assistant Additional Medical Superintendent, Sister Ansi Ando, the Nursing Superintendent, HODs, Unit Chief, Medical Staff, and all my dear Mata's family members. Good morning and a warm welcome to each one of you. It's my great pleasure and privilege to extend a heartfelt welcome to our esteemed Chief Guest, the Honorable Minister of Health and Family Welfare, Government of Karnataka, Sri Dinesh Gundu. Honorable Minister is an Indian politician of the Indian National Congress from Karnataka. He is serving as the Minister for Health and Family Welfare in the Government of Karnataka. Honorable Minister hails from Kushalnagar, Coorg. He is the second of the three sons of former Chief Minister of Karnataka, late Sri R. Gundu. Sir attended Bishop Cotton Boys School in Bengaluru and completed BE degree in Electronics and Communications from BMS College of Engineering in 1992. Sri Dinesh Gundu has distinguished political career with numerous achievements. He began his political journey in 1999 when he was elected as a member of the Karnataka Legislative Assembly from the Gandhinagar constituency. He is the sixth-time winner in the Karnataka elections, showcasing his strong connections with the electorate. He served as the president of Karnataka Pradesh Congress Committee, becoming one of the youngest to hold this position. He was also the president of the Karnataka Youth Congress, demonstrating his leadership skills early in his career. He was appointed as the All India Congress Committee in charge of Goa, Tamil Nadu, and Puducherry, reflecting his influence and responsibilities at the national level. He served as the Minister for Food, Civil Supplies, and Consumer Affairs, where he worked on issues related to food security and consumer rights. Since May 2023, he is the Minister for Health and Family Welfare in the government of Karnataka. Throughout his career, Sir has been actively involved in various community development initiatives focusing on improving healthcare infrastructure in the state. His dedication to public service and his ability to lead and manage various portfolios effectively have made him a respected figure in Karnataka's political landscape. As the Minister for Health and Family Welfare in Karnataka, Sri Dinesh Gundu has made significant contributions and achieved many milestones. Dear Sir, we are deeply honored by your presence today at St. Martha's Hospital, more than a century-old hospital, to be precise, 130 years of legacy. As we inaugurate our new CT and MRI facility, it's a milestone in our journey to provide advanced and compassionate healthcare to the ailing humanity. Your instant acceptance of our invitation shows that you are available and interested in overseeing the standard of the state's medical facilities. You also ensure that the stakeholders in healthcare deliver high-quality healthcare to all social strata and create a healthy society. We are deeply grateful for your presence today and deeply humbled by your role as Minister of Health and Family Welfare. I extend a wholehearted welcome to you, dear Sir. Please join me in extending a big round of applause as we warmly welcome our honorable guest, Sri Dinesh Gundu, Minister for Health and Family Welfare, Government of Karnataka. We are indeed honored to have you, sir, with us today. I request our director, Mr. Apachan Kutiyat, to facilitate sir with a shawl. And Dr. Christie, the medical superintendent, to honor him with garland. I call upon Dr. Arun, our additional medical superintendent, to present him with a bouquet of flowers. May I request Stancy, the nursing superintendent, to present him and hand over him our token of love. I would like to extend a warm welcome to all our dedicated doctors, nurses, technicians, support staff, and all other members of our hospital family. Your presence here today underscores your loyalty and commitment to excellence in patient care and service to the society. Today marks a significant occasion for St. Martha's Hospital as we inaugurate a state-of-the-art CT MRI facility that will enhance our diagnostic capabilities and help us to provide more precise and timely care to our patients. This achievement would not have been possible without the support and encouragement of our government and our community, and we are deeply grateful for it. We are confident that this new facility will be a vital asset in fulfilling our mission to serve all in need, especially the undeserved, with love, compassion, and dedication. On behalf of St. Martha's Hospital, I once again thank the Honorable Minister for gracing us with his presence and for his continued support of healthcare initiatives in our state. I also express my gratitude to all of you who have joined to celebrate this new beginning. With these words, I warmly welcome you all and hope that this will be a new beginning in the history of St. Martha's Hospital. Thank you and God bless.
Thank you, sister. It's my honor to invite our medical superintendent, Dr. Christy Dominic Savio, who is a pivotal figure in our healthcare facility, to introduce the state-of-the-art CT MRI facility, a cornerstone of our commitment to providing exceptional medical care. With a deep understanding of both the technology and its impact on patient outcome, Dr. Christy will share insights into how these advanced imaging tools will enhance our diagnostic capabilities and improve the quality that we can offer. Please join me with a loud round of applause in welcoming our medical superintendent as he guides us through the remarkable features of our new CT MRI facility.
Good morning once again, friends. Respected Sri Dinesh Gundu sir, Honorable Minister for Health and Family Welfare, Government of Karnataka, our dear staff, my colleagues, the heads of the departments, friends and well-wishers of the hospital, I once again extend a warm welcome to all of you for this auspicious occasion of the inauguration of the CT and MRI facility of our hospital. Before talking about the CT and MRI, I would give a very brief history of St. Martha's Hospital. St. Martha's Hospital, as all you know, is the first private hospital in Bangalore. It was established in the year 1886 by the Congregation of Our Lady of Charity of the Good Shepherd, also known as the Sisters of the Good Shepherd. The hospital was started in response to the urgent need for medical aid for those affected by famine and the plague epidemic which was raging during those days, around the middle of the 19th century, around 1850 and so on. There was a big pandemic of plague, and a lot of people were dying and suffering, and there was literally no people, no hospitals to take care of them. And this was the time when the sisters felt that there's a need for taking care of these patients, and therefore this hospital was started. So it began as a 50-bedded hospital, but over the years, as you can see, several departments were added. Now between 1963 and 1983, it served as a teaching hospital for St. John's Medical College, which has trained more than 1,000 young men and women to become doctors of high caliber. It was between these 20 years, this was a teaching hospital for the St. John's Medical College. And I'm proud to say that I'm one among them. I was here as a student, as an intern, as a senior house officer, and in this very hospital where I now stand. So today the hospital is a 450-bedded facility with specialty and super specialty departments, having all the necessary infrastructure and equipment and personnel to provide the required services. Now the CT and MRI equipment, these are the latest additions to the many state-of-the-art facilities that we already have. And this was a felt need for the hospital in order to treat patients well. And therefore, we embarked on this plan of getting these things. And I'm glad to say that we were able to get both these machines and install them here. The CT scan and MRI are modalities, as you all know, that can give us detailed imaging, images of the internal structures of the body, which is not possible by any other means. By simple X-rays and ultrasound, you may get a certain amount of information, but it never matches the amount of information that the MR and the CT scan would give. They are both able to detect even the tiniest of abnormalities inside the body, which, as I said, cannot be detected by any other means. Though initially they were used mainly for abnormalities of the brain, soon doctors started using them for diagnosing abnormalities in every part of the body. So today, these two modalities are being used for accurately diagnosing disease anywhere in the body. And in fact, during the COVID pandemic, these modalities had become very important, not only for diagnosing, but also for quantifying the extent of the lesion of the disease and treat them rationally. The difference between CT and MR is that the MRI does not use radiation, as you all know, for producing images. Instead, it uses a very strong magnetic field for creating images. Therefore, one of the main important advantage of MRI over CT is that it avoids all the dangerous side effects of X-radiation. So that way it is very safe. And the second very important advantage of MRI is that it can differentiate the soft tissues very accurately. For example, in a CT, a low-grade malignancy and a normal brain tissue will look almost similar, but with an MRI you can really make out the difference, and therefore you can pinpoint the lesion and treat the patient accordingly. So these are basically what CT and MRI scan will be doing. And I think I will stop here because there isn't much time left and sir is busy. He's got so many other appointments today. So we'll stop here and I would request him to go ahead and inaugurate the facility for us. Thank you so much. Thank you, sir.
I now request our Honorable Minister for Health and Family Welfare, Mr. Dinesh Gundu, to unveil the plaque and cut the ribbon.
For certain things, the CTs are better, for certain things, MRI is better. Certain things, CT you get better clarity.
Yeah.
No?
Mainly for bony lesions.
CT is better.
Some just open.
Yeah, MRI is better. Slices.
Yeah.
32 slices.
32 slices and it can be up to 190 electronically it can be 190.
Sister Superior of St. Martha's, Sister Gracie, and the Director, Medical Superintendent, and all the other dignitaries on the dais, and all the doctors and medical staff who are part of St. Martha's, and all dear friends. It gives me a great pleasure to be here because St. Martha's hospital is one of the most well-known hospitals, not only in Bangalore but in Karnataka also, because of its long history of more than 135 years, 138 years. So it is one of the oldest hospitals that I think among the first to come up. And then in Bangalore, we've had subsequently Bowring Hospital and Victoria Hospital and all those. So it has got a great history, and it has served the people with giving them good health care, affordable health care, and health care with a lot of compassion and love. I think that's what Martha's stands for. And so today we have inaugurated the new facility, the CT and MRI center. And I think this facility will definitely be of great value to all the people who come to St. Martha's, because nowadays these kind of diagnostics have become very, very important. And for a lot of cases, a CT scan and an MRI scan has become almost a compulsion. And it is necessary because as technology grows, we have to use the technology, and we need to keep abreast of it. And in medical science, every day there is something new that is emerging in terms of equipment, in terms of medicines, in terms of research. And it is sometimes, it is fascinating what all is happening in the medical field, in biosciences, in neurosciences, and to the extent that medicine is being able to solve how the human body functions and also how the human mind thinks. So these are all, I think, something that is really miraculous. And when we think of God and we think of, the higher power, we think of so many miracles that happen. And when we read our books, holy books, and when we read our history books and everything, we see so many miracles being performed. But I would say that at the same time, medicine itself is a miracle. And the field of medicine itself is miraculous, because the way you can look into a person's innermost parts of his body is under the microscope, under the scan, under the MRI, under the CT. You're able to know and see and understand how things are working at the most minute microscopic level. And that is something which is really, really, the medical field. If you think about it, it is the doctors and the nurses, I think they perform miracles every day. Every day, because they're able to, someone who's lost hope of living, they end up, getting their life back. Someone who has lost hope of being able to walk properly will end up being able to walk better. Someone who has lost his vision will get his sight back. Someone who cannot hear will be able to hear. So it is, in a way, miracles are performed every day. And the profession itself is such a humane profession. And I think it is a profession which has got so much, like it is literally in Sanskrit they say Vaidyo Narayana Hari, meaning the doctor is literally equivalent to God, because so much they can do. And people always remember the good doctors. People always remember the good nurses, because in their most difficult times, when a good doctor and a good nurse, they help them and save them, that memory lasts forever. And I think so the humane service that is provided, I think that is what is most required for the medical fraternity. Yes, we need more medical infrastructure, and of course investment in equipment is definitely today's values. Costs of equipment runs into crores and crores. Some equipment costs 10 crores, 20 crores also. So There is a investment needed. It needs to run, being able to be, the hospital needs to be managed properly, because there's a lot of ethics that is needed in the medical fraternity. Ethics are very important. And when that ethics are compromised, then that is something that we worry about. Yes, big hospitals are there which charge a lot. But if the costing is based on true, parameters, then there's nothing wrong. But we see so many things happening when people go to hospitals and they're simply made to do so many tests just to ensure that, these are all things that we look at. And in that way, if we see, I think St. Martha's is, nobody has any doubt about St. Martha's because of the way the hospital is run and the people behind the hospital, the management behind the hospital. And because it is not just a pure profit, motive. It is a service motive. And we need to provide for our people. We need to help our people. We need to be compassionate to the people. So I think that is the approach that everybody should have. And I'm very happy that St. Martha's is continuing its good work. And today, this facility, I think, will really help a lot of people, because now instead of going to get a scan, they have to go outside. And then to go outside, they have to probably end up paying more, and also it causes inconvenience. So today, anything that they need to do, check and test, can be done within the hospital. And we just inaugurated the facility, and it surely is a very good facility. Both CT and MRI, both are very essential today for almost most of the complicated cases. And I'm sure this facility will add to the greater growth of this hospital. And being the health minister, I can only assure the people of Martha's, the director, the sisters, all of them, that any support from our side, we are always will be there to do whatever we can to help you. And we are with you. We need you to become bigger, better, and to be able to serve our people more. You have a great history, and I think that reputation, even today, it still is there. And many people, because even from my own constituency also, a lot of people come here and they get their treatment done over here. And so we are very familiar that, even poor people, all of them, a lot of them, for them, Martha's is the hospital to go to. And that should sustain, should continue. And I wish you all the very best. And I am honored also today to have been given the opportunity to inaugurate this wonderful new facility in this hospital. So thank you very much and wish you all the best.
Thank you, Honorable Minister, Mr. Dinesh Gundu, for your apt words of wisdom, excellence, and inspiration. Thank you, sir. As we draw near to the end of our program, it's time to express our heartfelt gratitude to everyone who has contributed to making this occasion a success. It's my pleasure to invite our Public Relations Officer, Mr. Anto Diol, to deliver the vote of thanks. As the renowned author William Arthur Ward once said, "Feeling gratitude and not expressing it is like wrapping a gift and not giving it." Mr. Anto will eloquently convey our appreciation to all those who have supported and participated in today's event. Please join me in welcoming Mr. Anto Diol as he offers a sincere appreciation to all those who made this gathering memorable.
Dear esteemed chief guest, team of management, doctors, nurses, medical staff, and all my St. Martha's family members. I stand here on behalf of St. Martha's Hospital to extend my sincere thanks for the successful inauguration of our new CT and MRI scan center. This is one among the few scan centers which will be working 24/7. First and foremost, I would like to express our deepest gratitude to Shri Dinesh Gundu, Honorable Minister for Health and Family Welfare, Government of Karnataka, for gracing this occasion with your esteemed presence. Your support and encouragement mean a lot to us, and we are truly grateful for your time and inspiring words. Thank you, sir. I would also like to thank our dear Sister Superior, Gracie Thomas, Sister Superior and Secretary, and our team, whose vision and commitment have made this advanced diagnostic facility a reality. Your unwavering dedication to improving healthcare services at St. Martha's Hospital is commendable. Thank you, Sister. A special thanks to our doctors, nurses, administrative and paramedical staff who have worked tirelessly behind the scenes to ensure that this center is equipped with the latest technology and ready to serve our patients. Your hard work and dedication are the backbone of our success. We are also grateful to our partners including Siemens, whose collaboration and support have been instrumental in setting up the state-of-the-art facility. Your expertise and professionalism have been invaluable. Lastly, I would like to thank all our guests and attendees for being here today. Your presence is a testament to the strong community support that St. Martha's Hospital enjoys. We look forward for your continued support as we strive to provide the best possible care to our patients. Once again, thank you all for being a part of this significant milestone in our hospital journey. Together, we will continue to uphold the values of care, compassion, and excellence that St. Martha's Hospital stands for. Thank you.